Remarkable stories there for a most noble profession. Now, in a landmark occasion, this year's Nurses' Day falls on what would have been Florence Nightingale's 200th birthday, inspiring the World Health Organization, the WHO, to designate 2020 as the International Year of the Nurse and Midwife. And to talk to us a little bit more about this occasion, we're now joined via Skype by Howard Catton, who's the Chief Executive Officer of the International Council of Nurses, the ICN, and he's in Geneva, Switzerland. Howard, thanks so much indeed for joining us. Welcome to the programme. And we recognise Florence Nightingale as the first professional nurse, but I suspect that nursing has been with us since Adam and Eve.
Good evening, Peter, and it's great to be on this historic day, as you said, 200th anniversary of the birth of Florence Nightingale, first ever World Health Organization designated Year of the Nurse and the Midwife. Florence undoubtedly is the founder of modern-day nursing, and I've been thinking quite a lot about what she would make of what's happening and going on right now. Florence was a nurse when nursing was seen as quite menial work. It's not something that parents would have encouraged their children to go into. I think coronavirus has shown the world just how complex, how technical the skills and abilities that nurses need, sophisticated skills and ability that they need. Florence also took statistics and data into health systems in the 1850s to change them fundamentally. And she challenged traditional hierarchies and ways of doing things. And then when she came back from the Crimea, she set up the nursing schools as well. I've also no doubt that if Florence was with us today, she would be standing up for nurses, saying they must have the equipment, they must have the protection, we must look after them better. So I think there's an awful lot from our history of Florence, which is applicable to today.
All right, let's talk about this year's theme. What is it and why was it chosen?
The theme is nursing the world to health. We actually chose it before coronavirus took hold, and we chose it then because we could see that all of the health challenges that the world was facing, aging population, lifestyle diseases, yes, infectious diseases, this is the work of nurses. This is what nurses do. We were not going to improve health globally without a greater focus on nurses. But then coronavirus hit, and our theme couldn't have been more apt or relevant to today. The world is seeing just how central nurses and nursing is to the fight against this virus. But as was pointed out in your piece, I think it may be me who made the point, we went into this pandemic 6 million nurses short already. That's put a huge strain and pressure on nurses right the way around the world. But it also exposes in virtually every country the lack of preparedness, the fact that we had not educated enough nurses and healthcare workers, we'd not invested enough in our health systems, we'd not stockpiled PPE. And I very, very much hope that the legacy that could come from coronavirus, this special year for nursing, is a change in mindset and political thinking to seriously, consistently invest in health.
So I'm very partial to nurses because my mum was a career nurse, studied in Zambia, Ireland, and the UK. And so I know how special they are, but I'm just wondering, with the passage of time, are you finding enough people wanting to become nurses as a calling?
So I've worried about this because we have a shortage. We need to recruit more people into the profession. But the current reality is exposing how difficult some of the work is, how challenging it is, even the risks and dangers that there are for nursing. But actually, what I am increasingly seeing, and I very much hope that this is a trend that continues, is that people around the world are seeing nursing as a profession that can really make a difference to people's lives. And if you're looking for purpose in your own life, you're looking for a career where you can change people's lives, where you can save people's lives, where we're seeing the coronavirus, nurses who are stepping in where relatives can't be because of social distancing, and maybe the last hand that a patient touches before they pass or the face that they see. Nursing can offer a career like no other. But what we must do is that we must make sure that we are investing in the education system so that if people are interested, expressing an interest, that we actually have the schools, the universities, the facilities and the teachers to take people on. And that takes us back to money. We need commitments around resources and money to support the growth of our nursing workforce and the strength of our health systems.
All right, so on a day like today, you, especially as the CEO of the International Council of Nurses, you're out there to make sure that your nurses around the world are taken care of. What are you asking authorities in particular to be more mindful of when it comes to nurses around the world?
So we need to educate more nurses. We need to invest in education. I've talked about that. But it's not just a question of recruiting people into the profession. It's then retaining them. And like you or I, whichever job that you're in, if you're not looked after, if you don't feel valued, if you don't have decent working conditions, if you don't have good pay, if you don't have the equipment you need to do the job, if you don't have the opportunity to progress in your career, you may not stay and you may do other things. So yes, we need to educate, but equally we need to retain. And I think the other piece which is often missing from health systems is that there aren't enough nurses in senior leadership positions. We think that only about half the countries in the world actually have a chief nursing officer. So we would like to see much more development of an investment in nursing leadership positions.
Yeah.
That's not just for career development, but it's also, and I think coronavirus is showing this, nursing advice is critical for politicians, policymakers, health leaders to have to decide what the right response to global health challenges, a pandemic outbreak is as well. So we have a roadmap, but we need money and resources to support that to happen. And that's a really important part of the applause, the adulation, the accolades we're seeing from the public. Very, very, very welcomed. But we need to turn applause into action, clapping into firm commitments.
All right. So, I mean, I guess the usual things like occupational safety, PPPs and all of that. But I would imagine at a time like this and being on the front line every single day, things like mental health support must be quite a big thing for you.
It's a really key issue. I think we've all seen the pictures of nurses looking after people with coronavirus, and you get a sense of physically how demanding it is. It's not easy to wear all of that PPE for long shifts, but there is a huge emotional and psychological strain as well. Patients are anxious. They're separated from their families, from their nearest and dearest. And so nurses are providing that support to patients. But nurses' families are also often worried about them, and they may be separated from them. When they go home, they've got to be very careful about not spreading the virus as well. And in addition, in some parts of the world, thankfully it's only been a small number of cases, but still really worrying. Nurses have been subject to verbal abuse and physical attacks as well, because people have believed that they're spreading the virus. This issue about psychological and mental health support, it's important now, of course it is, but I also worry that it could be an issue that is stored up for weeks or months to come, and there may be some of our colleagues who are at risk or will suffer from post-traumatic stress syndrome as well. So you're absolutely right. When we think about nurses' health in the same way we think about people's health, we need to think about that in a whole way. It's physical and mental and spiritual well-being.
All right, Howard Catton, we could chat for quite a while, but unfortunately we've run out of time. Thanks so much for giving us your time this evening, and yeah, happy World Nurses Day, and continue to fight for us. Thank you so much indeed for the work of your members and nurses around the world.
Thank you very much as well.
Thank you. All right, that was Howard Catton, who's the Chief Executive Officer of the International Council of Nurses, the ICN, and he joined us via Skype from Geneva in Switzerland on World Nurses Day.